My name is Tyler. I'm going to be taking care of you this morning. I've already verified your orders, and I'm going to go ahead and give myself some hand hygiene and provide you some privacy. May you tell me your name and date of birth, please?
Tanya Burton, 9669.
Okay, great, Miss Burton. I got some orders from the doctor, and I need to get a few assessments on you. Is that okay?
Yes.
Okay, so now I'm going to go ahead and start off with your head and face. Have you ever experienced a stroke?
No.
Okay, great. Your head is round and symmetrical. Great, so now I'm going to go ahead and move on to your ears, okay? Do you wear any hearing aids?
No.
Do you have a lot of ear infections?
No.
Okay, how is your hearing?
Good.
Okay, great, Miss Burton. So now we're going to do this, it's called a whisper test. I'm going to have you hold one side of your ear, and then I'm going to whisper something in your other ear, and I want you to repeat it to me, okay? Okay, go ahead and hold that ear for me.
Pink.
Okay, great, Miss Burton. So now I'm going to move on to your eyes, okay? So I'm going to go ahead and ask you a few questions first. When was your last eye exam?
Last year, January.
Okay. Now I'm going to have you look at this object for me, okay? So I'm going to move it towards you and away from you, okay? Just to make sure that your eyes are constricted and dilating properly, okay?
Mm-hmm.
Okay. Open your eyes for me. Constrict. Okay. Now I'm going to go ahead and flash this light in your eyes, okay? I'm going to just make sure they're constricted and dilating. Okay, now I'm going to look at this eye and do the same eye. Good. Now I'm going to look at this eye. Good. And one more time. Good. Alrighty. So now I'm going to go ahead and move on to your nose, okay? Have you ever experienced a broken nose before?
No.
Okay, your nose is symmetrical. Okay, I'm going to have you hold one side of your nostril and breathe in and out, and then do the same for the other side. Okay, great. So now I'm going to move on to your mouth, throat, and neck. So your neck is symmetrical. Okay, can you go ahead and swallow for me? Okay, good. Can you say ah?
Ah.
Okay, it is pink and moist. Okay, so now I'm going to go ahead and ask a few questions, okay? Are you experiencing a cough or anything?
No.
What about sore throat?
No.
Okay, great. So now I'm going to move on to neurological. At the beginning of the assessment, you already told me that you're oriented to person. Can you tell me where you are?
In Georgia.
Can you tell me the president?
Biden.
Do you know why you're here today?
Physical.
Okay. Do you have any history of falls and hitting your head?
No.
Okay, good. So now I'm going to move on to your respiratory, okay? Okay, as I can see, you're not using any accessory muscles and any nasal flaring. Good. Okay, so now I'm going to ask you a few questions, okay?
Mm-hmm.
Are you shortness of breath or have a cough?
No.
Okay, good. So now I'm going to go ahead and educate you on turn, cough, and deep breathe. So every 2 hours, I would like you to turn, cough, and deep breathe to kind of get those secretions from your lungs moving. And then I'm also going to give you a device. It's called an incidence spirometer. So it helps to prevent you from having pneumonia. So what you're going to do is you're going to place your mouth on the mouthpiece, and you're going to breathe and inhale for me, okay? And either I or the respiratory therapist will set a goal for you that you will have to meet. And I would like you to do that 10 times every hour while you're awake, okay?
Okay.
Okay, so now we're going to go ahead and I'm going to listen to your lungs, okay?
Okay.
First, I'm going to start off using my diaphragm. Okay, when I touch you, I want you to inhale and exhale for me, okay?
Okay.
Okay, go ahead. Okay. Okay. Okay, that was anteriorly. Now I'm going to do it laterally. Good. Okay. Breathe. Deep breaths. Deep breaths. Deep breaths. Okay. all lobes sound clear. Now I'm gonna move on to your cardiac, okay? Are you experiencing any chest pains?
No.
Okay, so now I'm gonna have you lay back a little bit for me. Okay, and I'm gonna have you turn your head that way for me. I'm just making sure no JVD is detected, okay? Other side. Okay, now sit up for me. Okay, good. So now I'm gonna go ahead and palpate bilaterally on your radial, your posterior tibial, and your pedal pulse, okay? Okay, that's about a 2. For your posterior tibial, and now your pedal pulses. I'll give that about a 1. Okay, now I'm going to show you other pulse sites, okay? Yeah. So you have your carotid, your axillary under your arm, under your armpit, your brachial, your popliteals behind your knee, and then your femorals within your groin, okay? Okay, so now I'm going to go ahead and listen to your heart. And I'm going to start with my diaphragm first, okay? Your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral. Okay, good. So I'm going to do the same thing with the bell side, okay? Okay, great. So now I'm going to go ahead and check your capillary refills, okay? Okay, good. And then I'm going to go ahead and check for edema and also inspect your skin while I'm doing it. Okay. Okay, good. Now your lower extremities. Okay, good. So now I'm going to have you go ahead and lay down for me. And I'm going to move on to your GI, okay? So I'm just going to go ahead and inspect. I'm going to auscultate, and then I'm going to palpate, okay? When was your last bowel movement?
This morning.
Okay. So I'm just going to go ahead and look. Okay, everything is symmetrical, round. You always had an innie?
Yes.
Alrighty. Skin looks good. Okay, so I'm going to start in your right lower quadrant because that's where the vowel sounds start. Okay, good. So I will listen to it at least for 1 minute, but if I do not hear anything, for at least 5 minutes. Okay, it's normal active. So now I'm just going to go ahead and lightly palpate in the same areas, okay? Okay, good. Now can you sit up for me? All right, now I'm going to go ahead and move on to musculoskeletal. So I'm going to go ahead and do some upper and lower ranges of motion. 2 upper and 2 lower. So I'm going to start off with your elbows on both sides, okay? So I'm going to go have you flex, extend, flex, extend, other arm, flex, extend, flex, extend, Good. Now for your wrist, I'm gonna have you flex, extend, flex, extend, flex, extend. Okay, so now we're gonna move on to your knees, okay? I'm just gonna feel for your knees just to see if I feel any popping. Okay, so flex your knee, flex it, extend it, flex it, extend. Other leg, extend, flex, extend, flex. Okay, now I'm gonna have you do it for your ankles, okay? So I'm gonna have you flex, upwards, yep, and then extend, and then flex, extend, other one, flex, extend, flex, extend. Great. Okay, so now I'm gonna go ahead and have you walk for me. I'm gonna have you stand up. I'm just gonna test your gait and your balance, okay? So I'm gonna have you walk straight forward normally, and then come back on your tippy toes. Okay, great. So you're gonna stand right in front of me like this. I'm gonna put my arms on the sides of you, and then you're gonna close your eyes, okay? I'm just gonna check for your balance. A little movement is okay. Okay, great, Ms. Burton. Can you have a seat for me? Now I just have one more question to ask you, okay? Are you having any problems urinating?
No.
Okay, is it painful urination, or does it have an odor?
No.
Okay, what color is it usually?
Light yellow.
Okay, thank you, Ms. Burton. I'm gonna go ahead and do a few documents, and I'll be back to check on you, okay?
Okay.
Okay, thank you.
Thank you.